All right, everyone. It is noon, and we will go ahead and begin. Thank you for joining us and the Denver Prevention Training Center in collaboration with the Patient Navigator Training Collaborative. I am your host, Destiny Kelly, and we have great special guests today, both Dustin and Azul. I wanted to let you know that we will have questions at the end, so you can save them till then or just chat me in the chat box. I am under Denver Prevention Training Center. So without further ado, I'd like to introduce Dustin and Azul.
Great, thank you, Destiny. And welcome everyone to the LGBTQ Cultural Responsiveness webinar. We have you for the next hour, and we're going to go through some great information, everything from terminology to creating a welcoming environment. We are the Denver Prevention and Training Center. We are a CDC-funded capacity building assistance provider, one of 23 nationally. And if you want more information about CBRA providers, you can go to this website, cbraproviders.org. We're also part of the National Network of STD Clinical Prevention Training Centers, which services folks regionally. Again, I am Azul Del Grasso. I'm a workforce development specialist here at the Denver PTC, and with me is Dustin Wagner, who's a senior trainer with the Denver Prevention and Training Center. So our agenda for today is go over LGBT terminology, welcoming environments, and then at the end, we'll have the Q&A. And as Destiny said, feel free to type those in, or we can get you at the end of the webinar. So our learning objectives is to be able to describe proper terminology and pronouns when interacting with LGBT patients. And then when we look at comments from the field, when we think as a healthcare provider and asking about LGBT cultural responsiveness, a healthcare provider has said, am I supposed to ask all patients if they are gay? Or a patient has said to us, I feel like I'm being judged for my sex life when I go in for testing. And other healthcare providers will say that their values don't align with the work that they're doing, whether it's condom distribution, STD testing, HIV testing, or harm reduction. And then a patient will say, I'm terrified that people in the community will find out about my sexual orientation. So what we're going to do today is go over some terminology, update your knowledge about key terms, go over pronouns, and then what it is to create a welcoming environment. And as patient navigators, this might vary on the clinics that you're working in, or if you are working mobilely as well. Maybe it'll get you to start thinking about some of the practices you can do. And so with that, I will hand it over to Dustin Wagner.
All right, thank you, Azul. So we're going to go ahead and spend the next few minutes talking about LGBT terminology. And then we have a couple of activities that we'll actually be able to do during this process as well. So we'll go ahead and dive right in. This is going to give us more of a visual look at terminology. So for our visual learners, this will be very helpful. But we realize that terminology can be pretty confusing. We also recognize that terminology is always evolving and changing. One example I like to use is think about in the 1980s, how everything was rad and tubular. But now we don't really hear things being described as rad or tubular. So our vernacular changes, our terminology that we use changes over time. So while you might be familiar with a lot of the terminology for the LGBT community, it does also change and evolve and grow. So we'll go ahead and get started here. So the first one is terminology is a sex assigned at birth. So when we're talking about sex assigned at birth, this is when you're born, this is usually the genitalia that you are born with. So if you have a penis, you are usually assigned male. If you have a vagina, you're usually assigned female. And then we also have what's called intersex. For some folks, this might sound more familiar using the term hermaphrodite. That's an outdated term and can be offensive to the intersex community. So instead, we recommend using intersex, which means you're born with either both genitalia or ambiguous genitalia, or maybe different chromosomes. There are many different types of intersex. So when we're looking at sex assigned at birth, usually the two main categories are male or female. Then when we look at gender identity, this is the internal sense of what you feel inside. And so the sex assigned at birth plus the gender identity, if they are congruent with one another, so if you were assigned male at birth and your gender identity is man, you'd be considered cisgender. Same for female. If your sex assigned at birth was female and your gender identity is woman, you would be considered cisgender. So when we hear that term cisgender, that's what we're talking about. This is a relatively newer term, so if you're not familiar with cisgender, that's okay. That's now you are, and it's a newer term that has started to be used among transgender communities. So looking at the term transgender, we want to look at what does this mean? So when we look at sex assigned at birth being male, but your gender identity is woman, then that would be considered transgender. Same for if you were born female, but your gender identity is man, you would be considered transgender. So it's that there's they're not in line with one another, the sex assigned at birth and gender identity. And so when we talk about transgender, that's what we're talking about. And then we also want to discuss non-binary transgender. So this idea is the meaning of this term is that you can be assigned, a sex at birth, and then your gender identity is non-binary. And so what do we mean by non-binary? So when we think of gender usually as male, female. And so there's two. So when we hear the word bi, that's what it's talking about is two, like bicycle, two wheels. So non-binary, what they're talking about is that the person doesn't feel as though the gender identity of man or woman necessarily fits with what they're feeling inside internally. So non-binary doesn't necessarily subscribe to this idea of gender just being male or female. Instead, sometimes you can be portraying both, or sometimes you might feel a little more that you identify with a man some day versus a woman other days. And so just knowing that there can be some inconsistency with this idea of just gender being two genders. Instead, non-binary really takes this idea of gender being able to be more than just man or woman, or it might have components of both. So we have an activity here where we want you to help better understand gender identity. So if everybody could just go ahead and cross their arms over their chest like this. And so then I would like for you to take this top arm here, and I would like for you to, whichever arm that is, go ahead and put it underneath. All right, and so now everyone should still have their arms crossed, but now the top arm is on the bottom. And so we typically ask, how does that feel? And so I know that since we're on a webinar, it's not as easy to respond to that question. If you want to type your response in, by all means, please do so into the group chat. But the majority of times that we have done this training, every time we've done this training, people say that it feels strange or weird. So I have a request to do this again. So everybody please cross your arms over your chest, like so. So it looks like this. And then I'd like for you to take whichever arm you have on top, this arm here, and I'd like for you to put it on the bottom, just like that, okay? So now that you have your arm that was on top on the bottom, how does that feel? And so majority of the time, people say that it feels uncomfortable, or that it feels strange, or that it feels odd. And so we ask folks, how do we know what felt right versus what felt wrong for us? And so we think about, our bodies are built a certain way. We know what's going on in our bodies and what feels right and what doesn't feel right. And so when we think about gender identity, we think about how someone's internal sense of what's telling them what's right or wrong is going off. There's something telling them that there's something not right here. And so for folks that maybe their sex assigned at birth was male, but their internal gender identity, that sense is telling them that they are a woman. And so that's what, when you're thinking about, how you can tell the difference of what feels right to put which arm on top versus bottom, it's the same idea for somebody who is going through understanding their gender identity is not in align with their sex assigned at birth. And so hopefully this activity can help provide some understanding for you all when thinking about gender identity and what that might feel like for somebody who's transgender. How do they know that they're transgender, or how do they know that their gender identity doesn't fit their sex assigned at birth? And so I would encourage you to think about this activity and think about how do you know when your body is off or something's not right with going on with your body. So we'll keep on keeping on and talk about gender expression. So gender expression is how you present yourself to the world. It's usually when we walk down the street, it's how we're able to identify if someone is a man versus if someone is a woman. And so when we talk about sex assigned at birth being male, gender identity being man, and their gender expression being masculine. And so in our society, typically what we think about with masculine expression is you have a beard, you have a deeper voice, that you might have muscles, that you might have a hairy body. Those sorts of things are considered to be masculine in the way you express yourself. Versus feminine, in our society, we see people, having longer hair, wearing dresses and clothing, and tend to be more dainty and soft. So those sorts of things when we see gender expression from feminine. And then we have androgynous. So when we think of androgynous, really what we're talking about here is that this person might be walking down the street and you wouldn't automatically be able to peg them for being a man or for being a woman, but rather they fit maybe categories of both or neither. And so when we talk about androgynous, we're talking about just this idea of not really fitting completely into a gender stereotype of what is masculine versus what is feminine. And with the androgynous, the example that I like to use here is with really high fashion models, for example. And there have been models in the past that have been able to be portrayed as men or as women, and it's the same model that they're using to do both. And so that person would be considered androgynous because they don't have the expression of purely masculine or purely feminine. So when we see that the sex assigned at birth, the gender identity and gender expression all are in line with male man masculine or female woman feminine, that's what we call gender conforming, because we're conforming to this idea of what society is telling us gender is. And so, I have a beard, I have a polo, I have short hair. I'm conforming to the expectations that society has on what masculine looks like. If I were to have longer hair, shave my face, and wear a blouse, I would be presenting as feminine. And even though my sex assigned at birth and my gender identity is man, I would be presenting as feminine. That would be considered gender non-conforming because I'm not conforming to what society has dictated is appropriate for a man to express his gender as. So when we talk about gender conforming, we're talking about staying in line with societal expectations. This slide looks a little confusing, but it looks a little confusing for a reason. The reason why is because gender expression can be very complex. And so you don't necessarily always have to subscribe to this idea of what society is telling you how to express your gender. And I think that we all play with this in our own ways. I don't think that the idea of somebody embodying all things masculine all of the time isn't very realistic. Same with somebody embodying all things feminine all of the time, also not realistic. So, but there are overarching themes of how people do express their gender. So when we look at the sex assigned at birth being male, we see that folks can either present as feminine or as androgynous. And that would be considered gender nonconforming because they're not conforming to what society is saying is an appropriate way to express your gender. So we can also look down here at gender identity and gender expression, and the way that you identify versus the way that you express your gender might also differ. And so even though your gender identity is a woman, maybe you're presenting yourself in a more masculine way. And in doing so, you are also, you're not conforming to what society is telling you your gender should be, or your gender expression should be. So we also wanted to talk about sexual orientation. So so far we've talked about gender identity, your sex assigned at birth, gender expression, those sorts of things. That all has to do with your gender. With sexual orientation, this has to do more with who you are attracted to, who you love, who you want to date. When we talk about sexual orientation, we're looking at terms like heterosexual, lesbian, gay, bisexual, queer, pansexual, asexual. And so with those, that's again who you're attracted to, who you want to enter into romantic relationships with, physical relationships with, that sort of thing. So sexual orientation and gender identity, not quite the same thing. They do play together, but they are separate things. So we have a knowledge check. The first question is, what's the difference between sexual orientation and gender identity? So if anybody would be willing to type into the box, or you can also speak as well if you would rather do that.
Oh, you're wanting us to answer out loud?
Yeah.
Well, kind of like what you said with sexual orientation, it's more like who you're attracted to and who you want to be with, versus gender identity is what you believe yourself to associate your gender with, who you associate being. Am I male? Am I female?
Great. Yeah, that's a great answer. And we also had somebody in the comment box say sexual orientation, who you're attracted to. Gender identity is what gender you subscribe to. And so with sexual orientation, it is who you're attracted to. Gender identity is that internal sense of what's telling you your gender is. Also, the difference between gender identity and gender expression. Would anybody care to take a stab at discussing the two differences between those, gender identity versus gender expression?
It's doing that thing again.
So with gender identity, this is the internal sense of what's telling you your gender is, versus gender expression is the way that you're presenting yourself to the world and what that looks like. So, sorry everyone, I think we're having a little bit of technical difficulties.
Yeah. Never mind me. Nice random question.
Nine.
No.
Just cancel.
Let's see.
Okay.
All right. We'll go ahead and keep on keeping on. But that's the difference really between gender identity and gender expression. Is just the internal sense versus the external expression. So then we wanted to cover terminology around transition. So for transgender individuals who want to begin the transition process, it's not going to look the same for everyone. Not everyone's transition is identical. So some folks might have more of an end goal of having their body completely in line with their gender identity. For some folks, it might just be something as simple as changing their name and pronouns and the way that they dress. So it's important that we do ask folks what are their end goals with their transition when it's appropriate. If you're just running into someone on the street and you want to ask them what are their end goal for their transition, that might be a little bit different than if you're in a medical setting and you're trying to provide specific resources to that individual. So always be mindful of why you're asking that question and be able to explain why you're asking that question to the individual you're asking about their transition. But we look at it, we can break it down into kind of 3 different categories. So we have social, medical, and legal transition. So when we talk about social transition, we're talking about using an affirming name. So I was born as Dustin, but maybe instead I would want to go, if I'm transitioning, by Teresa. So that's an example of using a name that is affirming to that individual. Same with pronouns. My pronouns are he, him, his. For most women, their pronouns are she, her, hers. So using the pronouns that are affirming to individuals. Some individuals who don't, who are non-binary, might prefer the pronouns they, them, theirs. And so also just being mindful of and asking individuals what pronouns are affirming to you are important. Also with social transition comes wearing affirming clothing. So wearing the clothing that you feel reflects your gender and expresses your gender in a way that communicates what your gender identity is. And then being in affirming spaces. So accessing spaces where they would feel welcome to be themselves is important as well. When we look at medical transition, we're looking at I can never say this word, puberty suppression. And that is where you can take hormones to pause puberty from happening for an individual. So think about if you were born, your sex assigned at birth is male and your gender identity is woman, but all of a sudden you start to develop facial hair. What would that feel like? Or if you were born, your sex assigned at birth is male, sex assigned at birth is female, but your gender identity is male, what would that feel like to then start developing breasts? And so this being able to suppress puberty is putting a pause button on puberty so that an individual doesn't need to go through that until they can access different resources to be able to help create or move towards the body that feels more appropriate for them. So we also talk about hormones and how transgender individuals can be on hormones that can also help change their bodies to be more congruent with their gender identity and their gender expression. We also have non-genital surgeries. So this could be things like facial feminization or shaving down the Adam's apple so that it's not as obvious. Those tend to be more masculine traits. And so you can have surgeries that are not on your genitals that help to help transition as well. And then genital surgeries, which we also have recently just started offering vaginoplasties at Denver Health. So some of the legal things here would be a name change, sex markers on documents that you have. So instead of saying male or female on your driver's license, you could switch it to be the affirming gender or sex of what you identify as. Identity documents such as driver's license, birth certificates, those sorts of things. And then any other state laws that might come into play are also important as well. So we'll keep on keeping on. So these are some outdated or offensive terms. So instead of saying real sex, real gender, or genital sex, say sex assigned at birth. For the term atransgender or tranny, saying atransgender isn't necessarily offensive, but it definitely shows kind of this outdated information that you might have. The term tranny is offensive, so do not refer to folks as tranny. Same with transgenders or transgendered. It's not necessarily an offensive term as much as it is just would indicate to a transgender person that you might not be as familiar with working with transgender individuals, which would automatically put them in a defensive mode. Also, the term F to M used to be a woman born female, instead say transgender man. And the same with male to female used to be a man born male, instead saying transgender woman. The idea here is that you're just reducing somebody down to genitalia and that's it. And so we want to be mindful that a person is more than just the genitals they were born with. Talking about sex change, either being pre-op or post-op, instead saying medical transition. It's more inclusive in that regard. And then we already talked about this, hermaphrodite is considered an outdated and offensive term, instead saying intersex person. For sexual preference or homosexual, saying sexual preference implies that there's a choice going on here. And for pretty much any LGB person, they'll tell you their sexual orientation was not a choice. And so to say sexual preference shows some ignorance. And then saying homosexual is not an offensive term, it is outdated though. And so if you have somebody that you're working with and you call them homosexual, that's going to indicate to them that you're also not up to date on what's current terminology. And so that might not allow the person to feel comfortable or safe with you. So instead of saying homosexual, say sexual orientation or say gay or lesbian. And then gay lifestyle, homosexual lifestyle, transgender lifestyle can be an offensive term because it's this idea that all gay people have the same lifestyle, or all transgender people have the same lifestyle, and that's not the case. There's definitely, this is terminology that's been used by folks that have tried to attack the gay community when fighting for equality or fighting for equal rights. And so to say gay lifestyle definitely has a very negative connotation. So instead saying LGBTQ people and their lives is more inclusive. And this is important to just keep in mind that, this goes to show you that this is an ever changing, terminology is ever changing. And so it's important to try to keep up to date on what's going on in the LGBT community so that you can use the correct terms. So keeping up with terminology, just try to be mindful of using any disrespectful language. And if you do, that's okay, it happens. It's important to apologize and being able to learn from and move on from that experience. Also talking about a patient or person's appearance or behavior. I think that with LGBT individuals, we tend to be on high alert with the environment that we're in, and are we safe or are we not safe? And in doing so, you typically pay attention to people and how they're acting around you. And so if you're talking about somebody's appearance or behavior, a lot of times people will pick up on that, and you've automatically created an unsafe space for that LGBT individual. And then be mindful when you're saying things about someone that's not necessary for their care. So I'm saying, you look great, you look like a real woman or a real man. It's a backhanded compliment. Or saying, you're so pretty, I can't believe you're a lesbian. That implies that all lesbians are ugly, and so there's a surprise there that this person is pretty because they're a lesbian. So it has a negative connotation to it. So just be mindful when you are interacting with patients or with people when you're talking about how you're talking about their appearance.
Dustin, I have a question.
Okay.
When you came to your terminology, I know that talking about referring to patients, clients or just people as gay or lesbian, what about the word queer? Because I really stay away from using the word gay or lesbian unless that person has shared that particular identity with you, that's how they refer themselves to. But can you tell me a little bit about the word queer? Because I feel like sometimes queer can be, if people aren't well versed in all of this, it could be I don't want to call it a safety umbrella, but I feel like it's inclusive to LGBTQ. Am I wrong?
Right.
Right?
So thank you, Ronnie. That's a great question and a great point. So the term queer is an umbrella term, and it's used by both transgender communities and gay, lesbian, bisexual communities as well. And so the term, really what the term queer means is something different, different from what's considered the norm. And so when we're using the word queer, you could even say that, like driving down the street, that there's a car that might, be covered in stickers, and you can say that car looks really queer. So you can use the term queer just means different than the norm. And so when we talk about for transgender individuals, queer might mean, that their gender identity and their gender expression is not that of the norm. And so they might call themselves genderqueer or just refer to themselves as queer in general. And then you also have folks from the sexual orientation side of things. So being gay or being lesbian or even being bisexual, folks could identify as queer because their sexual orientation is not that of the norm. So it's a term that has been around for a long time. I think that I always caution people to be careful when using the term queer, because in the older LGBT communities, the term queer used to be a term that was used in a very negative way. And so especially if you're working with a LGBT population that's on the older side, they might take some great offense to you using the term queer. Versus the younger generation has been a term that they've really wanted to reclaim and that they've wanted to really make their own again. And so you see the term queer being used a lot more frequently among the younger community. So to that, I think that the most important thing is to really ask somebody ask them, how do you identify? And if they identify as queer, you have permission to use that with them. If they identify as gay, then use that term instead. So it's really what the person is most comfortable with. Now, if you're not comfortable, if somebody's like, I prefer to be called faggot, if you're not comfortable using that word, say, okay, I want to respect your identity, but I also want to respect my comfort as well. Is there another term that I can use to call you? So you also are allowed to be comfortable as well. But know that it's important to be respectful of people's identities and asking them, what do you think would be appropriate? Or is there an alternative that I can refer to you aside from what you've told me? So I think it's just important to really ask people really what is their identity and what do they feel comfortable with, and then try to use that language as much as possible. Great question. All right.
Dustin Azul, we have another question from the chat. Some of these terms change according to the culture. Is that not the case?
I'm not quite sure I understand. If I could have a little bit more clarity around that question. According to culture is a little confusing to me, so I'm not quite sure what the person is asking exactly when they say according to culture.
Sure. I'll ask for clarification. Thank you.
Okay, yep. All right, so we'll come back to that question, but for the sake of time, we're going to keep on keeping on. So I'm going to hand things on over to Azul, and he's going to talk about best practices for creating an inclusive environment.
Great, thank you, Dustin. And you had mentioned something a little bit ago, creating a safe space. And knowing terminology really kind of helps create that foundation of a safe space. And also being able to mirror the language of the client, which is extremely important. And we'll talk about that in a bit. But as patient navigators, you all know that you have clients that have a wide range of issues, whether it's substance, whether it's mental health, or just accessing healthcare. And really kind of the idea behind knowing terminology and looking at the best practices for creating an inclusive environment is removing those barriers and that friction that a client might have or perceived notion about going to the clinic, whether it's high-risk negatives and trying to access PrEP, or if it's HIV positive folks who are trying to stay retained in care. So let's look at some of this stuff. So when we think about creating an affirming clinic environment, and this can also mean if you're working in the field as a navigator, this works in the field as well. But you want to avoid labels. Sometimes we come to this work and we have our preconceptions about who people are and we have our own labels. What you want to do is kind of question that and avoid any labeling that you might do. And as Dustin pointed out earlier when we were talking about the term queer, use mirror language. You really want to talk in the language of the client, and if they prefer to be called queer, then you, as Dustin said, you have permission to use that. One of the things that we always say, the Prevention and Training Center, we sit within Denver Public Health and Denver Health and Hospitals. So we work very closely with our clinical colleagues. And we always say, think before you speak, right? Ask yourself, is this information necessary for me to help this person get the care that they need? For example, if a transgender woman goes in for medical care because she has a cold and the provider wants to know about her transition process, that's something that is inappropriate. And then really thinking about affirming names and pronouns. It's important to use the patient's affirming name and pronouns when talking to the patient. And I say this is not only from the navigation point of view, but it's also that frontline person, right? Who's checking them in, the MA or the nurse, or by the time they get to provider. If a client perceives any negative friction at any point of care, by the time they get to the provider, more than likely they're not going to want to really have a conversation about what's really going on with their healthcare. And so, as we know, most transgender women prefer that you say she or her when talking to them, and transgender men usually prefer he or his. Now, there's some pronouns, and they, them, theirs is just an example. There's a whole list of different pronouns for non-gender conforming, but sometimes people do not want to identify the gender binary that he or she is. So it's always important to ask. So pronouns, again, gender neutral, they, them, their, theirs. At Denver Health, we actually wear on our lanyard our preferred pronouns. That way people know before they even talk to us. And manage your own expectations. Don't personalize any reactions you may receive. As providers, as navigators, we're not perfect. We will make mistakes. Acknowledge those mistakes, and that's okay. And be willing to apologize. If you use the wrong pronoun, say, oh, I'm sorry, what are your preferred pronouns? Acknowledgement. One of the things we want to do is start deconstructing those barriers that clients may have. And the best way to do that is just acknowledge where you're at. And then we know, especially here at the PTC in our interview process, what's really key is the staff that you're hiring. Do they have the experience and knowledge to work with diverse populations? Are they comfortable working with the LGBTQ community? We know that staff is the biggest investment. And that's not only your provider, your nurse, your MA, a patient navigator, but it's that front desk person, right? And even some instances, I tell clinics when we go around the country doing this training that it's the security guard as well, right? Because patients might go up to a security guard and be like, oh, do you offer PrEP? So it's important to train, the entire staff. And, we gave an example here of, tell us about your experience working with marginalized populations, including LGBT communities. You really want to know that person's experience. And if they don't have that much experience, are they willing to work within those communities? So again, staff time is your biggest investment. And then what is the environment of the clinic, right? So posters, clinic messaging, do you have pride flags? It's the subtle messaging that matters. Because when I walk into a clinic, I want to be able to see people and things that represent me, right? And so it's important to have, whether it's the posters, the pamphlets, maybe it's unisex stall rooms, privacy of the registration. If I'm a transgender female and the name given to me at birth is David, but now I want to go by Daphne, don't call me back by David, and be loud about it because you've just outed me in front of the entire waiting room. So it's being mindful of these little subtle things that can create huge barriers, because the time I would get to the provider, I'm not even willing to be open about what's going on with my sexual health. Again, going into the clinic, maybe I want reading materials, that I will identify with. And one point to say is, as patient navigators, if you're out in the field, one of the things that is key and we use are lanyards. So for this, I can be anywhere and someone knows that they can come up and talk to me and ask me questions just by me wearing this lanyard. So it's the subtle messaging that counts. And then staff training. I mean, you'll have an hour with us today, but however, we do this training that lasts, we've had 2-hour versions, we have 4.5, all the way up to 4.5-hour versions. This really is the beginning. And some of this might have been a review for you, some of it might be new, but this is an ongoing process. We've talked about the frequency that language and terminology changes. Just giving the example of the term queer for. So you want to be able to have accurate and appropriate up-to-date resources. One of the barriers that we do have, especially when working with transgender patients, is the lack of data. And so that's starting to change as we're starting to collect more SOGI data. You want to be able to expand your knowledge about sexual practices and what it is to create a sex-positive environment or a sex-positive experience if you're working one-on-one with your client. And again, terminology is always key. And there was a question earlier about terminology. Terminology does change by culture and region. I'm kind of reading that as, for example, in certain parts of the country, African-American men hate the term down low. They've started using the term same gender loving. And those terms change not only by region, but also by culture. So understanding where your patient population is and where they're from, because they might be using, if they're from out of state, they might be using different terms that mean the same thing that you have here, for example, in Colorado. And then staff communication procedures for patient preferences. If you have the ability to modify your electronic medical record, we highly recommend that. We know a lot of clinics around the country, sometimes they're still using paper medical records, is really kind of creating an Excel sheet or whatever it is you can to note down the patient's preferred name and their preferred pronouns. And that also is a good reminder to staff to be aware of this stuff. And avoid assumptions. You cannot assume someone's gender or sexual orientation based on how they look, right? So to avoid assuming gender or sexual orientation with new patients, what we really advise is neutralizing your language. Instead of saying, "How may I help you, sir?" just ask, "How may I help you?" Instead of saying, "He is here for his appointment," just say, "The patient is here in the waiting room." And don't assume that people are in relationships, but do you have a wife? And just say, "Are you in a relationship?" And lastly, and not mostly, but what are your mother and father's names? Well, a patient might have 2 dads, 2 moms, right? So what are your parents' names? So really starting to think about that stuff. How can you neutralize the language that will start to remove some of those barriers that you encounter? And then have the courage to put what you learn into practice. If you're unsure about a patient's preferred name or pronoun, just say, "I'd like to be respectful. What is the name and pronoun you would like for me to use?" Patients prefer that you ask instead of assuming, right? And it creates a good relationship with that patient. And if the patient's name, and we see this sometimes at the hospital, if a patient's name doesn't match the insurance or medical records, just say, "Could your chart or insurance be under a different name? And what is the name on your insurance?" Right? And allow that patient in a discreet way to confirm, okay? And if you accidentally use the wrong term or pronoun, again, it's okay to apologize. It's okay to acknowledge where you're at, and it's okay to acknowledge these little mistakes. And then continuing education and resources, right? So providers knowing your hospital policies, standards of care, and we'll be able to provide these links to these different things. But we have a great site at the Denver Health LGBT website. There's the Gender Identity Center, the Gathering Place, PFLAG, Trans Lifeline. Know your resources. And it's always good to go back. I go back almost every other month to look at these resources to see if something new is out there. And so we want to thank you for joining us today and open it up to any questions that you may have.
So Azul addressed the question about culture.
Oh, I just wanted to say thank you. It was very informative. I didn't have any questions, but I thought that was a great talk. It helped clear up some things. So
Great, thank you.
Same here. It was a really great presentation. I really encourage everyone to continue the staff training. We talk about, you guys brought up a really great point that it's not just the medical staff that should have these trainings. Also adding that interview question that we talk about, do you have any experience working with marginalized population, including the LGBTQ, and are you willing to get, training and all of this? But I think about it because I think some of our current challenges is the EHR system, and sometimes what I personally see is that we have someone in charge of records, let's just say, and I don't want to use the word bias because I don't want to make assumptions, but I think sometimes people can be a barrier when we're trying to document properly on our patients on how they like to be, what their name would like, and then there's that conflict of like, well, legally they haven't changed it, or we have to follow the rules, and I understand that, but just having these conversations on, how are we adapting to make sure that we are providing not just high quality care, but we talk about wrapping services around our patients and our patients' comfort. So how does that match up to when a patient has a request like that? And so sometimes I see it I sit at certain tables where it's challenging for the people that are in charge of administration to kind of, talk about changes or why it's not supposed to be done that way due to laws, due to blah, blah, blah. But it's like, okay, but what can we do in the meantime until we're able to change some of those things to follow, the rules or whatnot? So I guess I'm just pondering about that just within my own organization. Like, I feel that where are we doing a great job in, and then where are some areas for improvement?
That's a great point. And doing this work around the country, one of the things that we recognize is that each agency and clinic is different, and each agency is at a different stage of change, let's say, right? And so sometimes it's not, taking away from this training and then going back and then, all of a sudden everyone's using preferred pronouns. Sometimes it's taking this information and talking with the gatekeepers within the agency to start the conversation. We were just in South Carolina where we had this training as part of a PrEP institute. And we know that, what the rollout of something like this looks like. For some agencies, it's a couple of weeks. They get staff buy-in, they get leadership buy-in, and they run with it. Other times it's difficult, and we have to acknowledge that. Sometimes it's a 6-month or several year process to get staff buy-in and then to get leadership buy-in. The idea behind this is really to continue the education component. If you take this training and then you know a colleague who could benefit from it, then bring them on next time. And at some point, how can you get leadership to be part of a training like this or to share this information with leadership so you start to break down those barriers, so that you start to be able to make those systematic and institutional changes that are necessary, which the institutional side sometimes can be painful and long, but this is where we start the conversation.
So we had a couple of questions in the group chat. One is, what's the preferred terminology between SGM, which is sexual and gender minority, and LGBTQ? So for SGM, sexual and gender minority, that's typically going to be used more in a professional setting, when talking to colleagues, when talking to providers, that sort of thing. LGBTQ is more so a term or used among the community themselves. So when you're talking about SGM, that's definitely much more clinical. So I would probably avoid using that terminology with your clients. because it's not something that's as popular or well known about among the community themselves. Another question that was asked is, can you address the questions that were asked to everyone? And so I'm unclear as to what the person's asking here. From the questions on the slide set, I believe that we did answer all of those questions. So if there's a specific question that you felt did not get answered, please do let us know, and we can make sure that that is answered. So, and then it looks like Jolene, I'm sorry if I mispronounced that, made an important point that it's important to remember that there's trans privilege here in the US. I know it's difficult to think of privilege in these terms, but there are many undocumented individuals who cannot change legal documents. So it's even more important to make sure our clinical documents are respectful of our patients' preferences. So using that affirming language on your documents can be very important for those individuals who don't have the ability to change their legal documents. I think that's great.
Yeah, thank you for that.
So we have some time for a few more questions if folks are interested.
This is Destiny. I had a couple questions in the chat about where to get the inclusive posters to hang in your clinics. Would you know that off the top of your head that I could send a link?
Not off the top of my head. I know that there are a couple of organizations that do have some posters that you can use, and they leave it blank so that you can put your agency's logo on it. But off the top of my head, I can't remember. That is something I can look at and then have Destiny send out to the rest of the group. But off the top of my head, I can't remember exactly where to go to get those.
Sometimes it's great to work with the public health departments or the state health departments who might have materials. But to be quite honest with you, the agencies that I've worked with around the country is sometimes you have to create your own materials that represent the community you're working in. And that can be challenging, you know, managing staffing time, getting the budget to print stuff off. We recognize that, but sometimes that's the best way to do it. I know of several agencies in California who've created their own materials. There's a great agency called Altamed, and they've created a whole series of materials for folks, and they are willing to share those materials. I don't know if the California Clearinghouse is still around. I know that they had some materials. I can look up those resources and get those to you. But at the end of the day, it's really kind of asking partner agencies and partner health departments if they have materials that they can share.
Great. So it looks like Amy was able to provide a link in the chat for folks if they are interested in visiting that website. I think that will be helpful as well.
Thank you. Well, excellent. If there are no other questions, we really want to thank you for joining us. Oh, here we go. Can you say more about living on the down low? Most of the instances I've heard about involve gay men who have not been forthcoming with their female partner. It's a great question.
So living on the down low, I think it comes from this idea that it's not safe to come out as your, to identify yourself completely. And so I think that to frame the question of saying that gay men haven't been forthcoming with their female partners, you're missing a little bit of kind of the background of why that's happening. And so for men, it tends to be that they have been in environments where they feel it's not safe to be out as a gay man. And so being on the down low has kind of come from that the idea is that it's a safer way to identify. Also, there are some men who do have sex with men who don't identify with gay culture, so they don't identify with the stereotypes that exist. So, when you think of gay men, the stereotypes are that we all love shopping, that we all are very well dressed, that we all like to go, that we all like to go out to the clubs, and that, you know, there's always sex involved all the time, and that we tend to be more feminine, and that we want to watch drag shows all of the time, and all of that stuff that is associated with the label of being gay is then placed on those individuals. And so it's not always that they're trying to deceive their female partner, but rather they're operating from a place where they feel the safest, and they also feel that they don't have to have an identity tacked onto them that doesn't represent who they are. And so so it is a complicated identity that folks do sometimes take on that identity, and it can have a very negative connotation in the community that, you know, if you're on the down low, that you're deceiving or that you are putting at risk your female partner. And there are components of truth to that, but I think it's really important that we look at the larger picture and see, why is this happening in the first place? Why is this going on the way that it's going on? And so I think if we are able to see what are the other components that are feeding into that identity, it helps to make a little bit more sense of why it exists.
Yep. And perhaps the individual does not want to come out, or doesn't feel the need to come out. We also have to remember that there's instances for situational sex, or even survival sex, which some we've kind of blanketed as down low, but really kind of understanding what are those social determinants that are creating the situational sex. That's very important. And then there's also, we have to acknowledge that there are cultural barriers too, whether, you know, it's African American or Latino, or is it the church, what communities come from, and the stigmas and the history that our communities have experienced from these areas. So again, just things to be thinking about. All right, well, that does bring us to a close. I want to thank everyone for joining us today. Again, this is just the beginning of the conversation. It is not the full conversation. We actually do this training in about 4.5 hours. And again, we say this is the beginning of the conversation. So thank you everyone for joining us. Feel free to reach out to Destiny Dustin or myself with any other questions. One last point. Daisy has, what is survival sex? Survival sex is when an individual is in a situation for economic reasons, they need to engage in exchanging sex for money. So, and that'll conclude our questions. Again, thank you everyone. Have a wonderful afternoon. We look forward to seeing you in other trainings.
Take care. Thank you, everyone.